Hi, I'm Dr. Elisabeth Coyne, and with me I have Julia. And we're just going to look at how you might share distress with your family and how that looks, and just different ways to go about being aware of your journey and sharing that. And so I think the main thing to sort of be aware of, and I know a lot of my previous research has highlighted this fear of sharing distress, and I think you need to sort of actually start to get times that are useful for actually saying, well, this is what I'm feeling, and so, feeling confident to just share your distress, because that actually then allows other people to step in and help you.
Yeah.
And we've talked before, Julia, about sort of having that time to have that one-on-one talk. And what sort of times did you sort of use?
We use things like going to a park and just sitting on a bench, because it was a different situation. It was a calm situation, and we could just have conversations about things that were concerning us, without it being about blame or guilt. Or it was just, this is how I'm feeling. It's okay.
Yeah. And so did you sort of have any troubles sharing and your family the distress and worries with health professionals, and what sort of ways did you go about sort of dealing with that?
It can be really difficult because health professionals have very limited time, and that time's getting shorter and shorter.
Yeah.
So it's hard to find time in those appointments to say, look, I'm concerned about these things. So sometimes it's a bit of a negotiation between you to go, okay, well, we need this information, but we also need to ask these questions.
Yeah.
So go in with those list of questions about what I need to know.
Yeah, and the list of questions is a great idea, because it means that often you don't see your health professional, especially your consultant, very often, and so it's time to put that down. But the other aspect is to actually talk to your GP or your nurse navigator or your vet. Often you'll have an allocation of a nurse, and not that they may be able to answer your question, but they can help you work out where you need to go best, or the way to approach the question.
Absolutely.
And so really think about actually acknowledging and sharing that distress. Don't hold on to it, but work out the best way to sort of go with it. Yeah. And that leads us to the next time, is about, often in your family groups, there will be times where different people will have, meltdowns and times that they'll need you to be a good listener. And it's important to actually be that good listener, and don't minimise the distress they're feeling.
No, because it's all very real.
Yeah.
The stress that your family is having is as important and as real as the distress that you have yourself. Yeah.
And I think that's an important fact to remember, that whether you're the family member and it's other family members, that you don't know what they're feeling, and so it's really important that it may bring up other memories, past friends, family. And so it's important to just acknowledge that distress, and then, work through and help them find the best avenue. And it's not that you can fix it, but you may be able to head them in the right direction for them to then work through it.
You can, try and give them some of the tools that you've used to get through it, like journaling and things.
And remembering always that those helplines are there as well. And that it may seem like, or they should know, but when you're feeling overwhelmed, you don't know. That's why you've come. And so if someone sort of comes to you, it's important that you do really say, have you thought about ringing a helpline? Have you talked to your GP? Because, distress left unmanaged, is never a good outcome. And so it's really important to sort of work through that and just listen to them, acknowledge, and then sort of offer some different ways. And I think one of the key things, and my research has really identified that communication within the family, if that way is working well, then they'll actually get better outcomes overall. And I think one of the things is to identify how the roles change after the diagnosis of cancer.
For me and for my family, my husband had to take over looking after the children, working full time, and looking after me, and for him that was very difficult. And it was difficult for me as well because all of my
Yep.
role as mother and homemaker
Yeah.
had suddenly been taken away
Change,
from
yeah,
me.
yeah.
And it also affected my youngest son. He's sort of took on a role of carer after I'd had surgery, and he would phone me daily to
Yeah, yeah.
on his way home from school to see if I was okay and where I was. And
Yeah.
yeah,
And I think it's important to not sort of change their role, but
no,
acknowledge if that's the role that they feel comfortable in.
Yep.
And I know a lot of my research, they've talked about sort of how, you know, sometimes if someone's really anxious, they would rather be at the appointments
Yes.
than waiting at home. And so, you know, let that happen. Don't sort of say, well, you know, you can't go, you make everyone else anxious, but actually working through that and helping them sort of to work through that.
and giving them a job to do.
Yeah,
if there's
definitely.
something really good at, you know, if there's something they're really good at, like taking notes or, you know,
Working
writing down
through
lists of
Google.
questions, Googling things,
Yeah, yeah.
finding support groups, that kind of thing,
Yep.
then, you know, give them a job.
Yep, that's perfect, yeah.
Yeah.
And I think the key to that is that open communication of
Yes.
just being aware of different people's sort of how they communicate. And not getting stuck on visual cues. Julie and I talked about this earlier about sort of sometimes your face may be saying, you know, I'm tired, I'm angry, I'm hurt,
Yeah.
but that's not actually the way you're feeling. And so, especially with a patient with brain cancer, their face may not be the perfect cue for what they're actually feeling.
If you've had, like I had a bit of a stroke during my surgery, so I've got a bit of facial droop and I've got a bit of a resting pain face.
Yeah.
So it can be hard for my husband
Yeah.
and my family to sort of
Work out where you are.
Work out where I'm at without me sort of speaking to them and saying, no, I'm okay.
Yeah. Yeah, so just be aware the visual cues don't always make sense in the trajectory you're sort of going through. And I think it's really important to use the word I.
Yes.
I'm feeling this way. When this happens, I feel this way. I'm upset. I don't want, you know, to upset you, rather than saying, you know, you make me upset, or you always seem angry.
Yeah.
So, yeah.
Yeah, not blaming each
Yeah.
other.
Yeah.
You know, taking responsibility and saying, this is how I'm feeling.
That's right, yeah.
You know, it's not your fault, it's just...
It's me, yeah. I'm having a sad day today, and actually bringing it out there openly, so that the other person knows, oh, okay, you know, it's okay to have a sad day, and as long as other people are aware of it, when they don't sort of need to try and fix it.
Yeah, it's okay, I'm having a sad day.
Yeah.
I'll be okay tomorrow.
Yeah.
I may be okay this afternoon, but right now, not so much.
Yeah.
Yeah.
And I think the other thing, we talked about role changes, but I think it's important to be actually open to the role changes, that, you know, both for the person that with cancer, the other caregivers, you know, working out who's a good leader through all of this, who can take on the different roles, who can be the person to have the phone calls with everyone else, and how does that look and how does that work? Who's good at finding information?
Some of the best ways that we found to share information with the rest of the family was we set up a Facebook group and put all the family members in that, and just did one update which went out to everybody, and then if there were other family members who weren't in the group, it could be passed on by you know, aunts and uncles and things, and that way we weren't constantly on the phone. Yeah,
because that can be quite distressing, can't it, Julia?
It can, when you have to just constantly repeat, you know, I have to have this done, I have to have that done, I'm doing this. It becomes...
burdensome.
It's really hard to deal with because it's constantly in your face.
Yeah, and it doesn't allow you that time out.
Yeah.
And it's okay to not answer the phone as well. To sort of have those times where this is our time just to sit.
We still do it. My phone goes off at 9 o'clock and it doesn't go back on until 8 o'clock in the morning. Yeah,
and I think that's important. And that leads us to our last point, which is about time to reflect on the changes in communication, because it's important to sort of, and I suppose that goes with that aspect of journaling, writing, to see where you've come from and how you're going now, and you know, whether it's sort of something you do every couple of days, every week, every month, but just sort of have a say, well, actually, how are we going? How's this week going? How's this month going? And what are we up to? And
oh, this is how I was last month, this is how I am this month. Sort of, you know, there's some improvement there.
or you
Or
know,
not.
it's or not, and it's okay that you know,
Yeah.
okay, well, this is something that we need to work on
Yeah.
together, and this is something that we've done well.
It helps to identify those
Yeah,
pain points.
that's right. Yeah, and then, you know, it's not. This is about life, really, not just about sort of you know the trajectory of cancer, but this is actually sort of good skills.
The day-to-day.
Yeah, yeah. And so this is sort of the pulling of words from another set of transcripts, which were from rural and remote people with cancer. And I thought it was interesting to look at the sort of the time, live, honesty, you know, the different ways that their words have come across. And do you think it makes a difference where you live, your attitude?
I think it does. I think if you're in a rural or remote area, you sort of just have to get on with life
Yeah.
and living and getting the things done. Whereas if you're a more metro person, your resources are more available.
Yep.
You know, they're closer. You can go and see psychologists and
Yeah.
things fairly easily. So you tend to sort of sit back and go, okay, well, we'll just manage this.
Yeah, yeah.
Whereas rural and remote people are just like, I have to do this. You know,
Yeah.
this has to be done.
Yeah, I'll work this out.
Yeah.
So, yeah.
Yeah.
And so it's good to actually reflect on that, on where you live and how you see life, and be aware that it is different for everyone, and that's okay. And it's just about working through that and being open with that communication.
Absolutely.
And finding the best way forward, and that gratitude in every day and every week of looking for something different.
Yeah. Looking for something nice.
Yeah.
Yeah.
Thank you.